Hey guys, you're back with Lisa Marie Johnson, and I figured I should finish my paper. So this would be part 2 of my presentation. We talked about, my paper is called The Link Between Depression, Anxiety, Motivation, and Exercise. We just went over what depression and anxiety was, or are. Now we'll dive into the exercise portion. So why exercise for mood is different. Exercise can provide an immediate mood lift, especially when you feel bad beforehand. Okay, so exercise can improve your mood, even if you felt bad before you started. Although it may take a while to climb out of depression with exercise, most studies of antidepressants, therapy, and exercise look at gains across 8 to 12 weeks, which that means is studies show that when you take your meds, you go see a therapist, and you also exercise, okay, you will see gains, you'll see improvement over 8 to 12 weeks. Okay, it's not a all fixed thing. Wish it was. There's nothing really out there that's a quick fix, okay? But exercise will help you climb out of your depression. Kovu. It allows you to feel more connected to others. When it talks about exercise, it allows you to feel more connected with others. Exercise can help you treat depression. Kovu, stop, please. You're being too noisy. Exercise can help treat your depression, lower your stress, reduce your anxiety, ameliorate your anger, and enhance your well-being. So, exercise. I know, I see him. I know. Shh. Okay, so exercise treats depression, lowers your stress, reduces your anxiety, manages your anger, and enhances your well-being. Exercise can do all of that. One of the benefits of exercise is that it can both clear your head and quiet your mind, while also enhancing your attention and memory. So, benefits of exercise: clear your head, have a quiet mind, enhance your attention span and your memory. I'm preaching to the choir. I need to start exercising. I'm trying. See, I have to do this too. I need to refresh my memory. How do I get out of this funk, you know? Okay, so exercise and stress. Exercise whips your body into better shape to handle stressors. Okay? Exercise in itself is a stressor. When you exercise, you're putting stress on your body, which requires effort and forces the body to adapt to the demands placed on it. Okay? So, exercise whips your body into shape, basically, in order to handle stressors. So basically, you are, as an anxious person, we do not like stress, okay? We are afraid. We are trying to avoid anything that's going to cause any type of arousal of bad feelings, okay? Stress, panic, depression also plays a role in that, okay? So if you are actually putting the stress on your body voluntarily, then your body will adapt. The body will adapt. which makes you even stronger for when those panics happen or when your other emotions try to get the best of you. If you voluntarily put stress on your body, you know what you're doing exercise, okay? That makes your body stronger to resist other stressors. So it says your body is toughened by exercise. Okay? A study, physiological and psychological. Okay, so physiological is your heart rate and your blood pressure. Psychological, kovu no. Psychological is mood and anxiety symptoms. Where's your toy? Reactions to the stressors are reduced individuals who exercise. Okay. I don't know why you needed to know that first part, but reactions to stressors, you know, we react to things, are reduced in individuals who exercise, which is a very good thing when you're anxious. Kovu, stop. When you're anxious, you know, you want that to go somewhere. You want that stress to go somewhere and not panic inside of you. So this is how you would do it. You would exercise. Okay. Exercise and neurotransmitters. This is kind of going into the anatomy of the human body. So reduced levels of serotonin play a role in causing or maintaining depressive and anxiety disorders. Okay. So I'm just telling you, reduced levels of serotonin. Okay, serotonin is a hormone or a chemical. I think it's a hormone. Anyway, reduced levels of this hormone, serotonin, plays a role in causing and maintaining depressive and anxiety disorders. Okay, the serotonin, we're reduced level of serotonin. We're very low. So exercise increases serotonin production in a manner similar to the desired action of antidepressant medication. So exercise increases your serotonin. Okay, you're down here rock bottom. You're depressed, you have anxiety, you are just, oh my God, right? You have very low serotonin. If you exercise, that serotonin will rise, allowing you to not feel as depressed or as anxious. It will help you counterbalance your mood. It says it's even similar to the desired action of an antidepressant. So if you are like anti-meds, you know, I'm not taking medication, at least exercise. It's a kind of a form of an antidepressant medication because it will increase your serotonin level. Okay. Motivation from the outside, motivation for the outcome compared to the motivation for the effort needed to get there. Okay, so you have motivation for the outcome. You want to feel better, right? Or lose 100 pounds or whatever. You want the outcome. But compare that to the motivation for the effort needed. You want to lose that 100 pounds, but you have to get up off your butt, okay? And actually do something. You want to feel better, but you have to get up. You have to get up. Do something. So a habit often helps you accomplish your goals even when feelings of motivation fade. So you need a habit. I need to get into this habit of exercising every day. And so do you. Okay? I know you don't. Don't lie to yourself. I know you don't. Okay, so a habit often helps you accomplish your goals even when you're feeling motivated, low motivation. Okay, how to fuel your motivation to work out. So how do I get to that point, right? I'm sitting on the couch, I'm anxious, but I don't want to do anything. Okay, so how to fuel my motivation to work out. If you exercise, you will feel different right away, giving you an easily tight giving you an especially tight linkage between the behavior and the mood goal. Okay. You just have to know, I guess, how to fuel. So how to fuel your motivation to work out. How do I get myself motivated, right? So the way to do that is just to know if I exercise, I will feel different right away. What you do, you increase your serotonin. So your mood will be uplifted or whatever. That's why it says it's a linkage. There's a link between a behavior and an outcome. If you link those, say, okay, if I work out, then I felt better and I want to do that again, you know. So that's linkage in your brain. Behavior and mood goals. Okay, the catch is that you will have to make yourself exercise. And exercise at a reasonable pace and with a reasonable focus so that you can enjoy these mood benefits. So I don't want you to be like, oh, I gotta work out. Lisa said you have to work out. I'm gonna bust my butt trying to do this aerobic class or whatever, and I don't feel better at all. That's not what I'm saying, okay? You have to exercise at a reasonable pace, okay? If you're older, your body's older. You have to do it differently than when you were 10 years ago, you know? You have to go where your body is fit at that time. You can't make it do something else because you're not there right now. So reasonable pace and reasonable focus. So what is your focus? Why are you doing this? Why aren't you running a mile or whatever? Why did you choose to do aerobic therapy? Why do you do step-ups instead of sitting in a chair? You know, why? So once you actually try to exercise for mood, that's in your brain. You have to exercise for mood, not to lose weight, not to look better, not to fit in your clothes. Exercise for your mood, okay? You will have a stronger linkage. You'll have a stronger linkage. Kovu, stop it. That is, you will be more motivated to exercise after you experience the mood benefit for yourself. So that's the thing. It's kind of like a drug. Except this is a good drug, okay? People offer you, hey, have some drug or whatever. And you be like, oh, okay, well, might as well. Peer pressure. You take it and then you're hooked, right? You want more and you want more, you want more. That's what they want with exercise, okay? You have to make yourself do it. You have to make yourself do it. And then after that, you realize the benefit of how you feel. This is all feeling. This is a depressive anxiety motivation paper, okay? All right. So look outward for motivation. Okay, here we're getting somewhere. Research shows that motivations are influenced by others. Hearing a friend say, I really want to get in shape. Seeing people walking in one's neighborhood. Motivations are also affected by mood. Okay. If you become frustrated while pursuing a goal, motivation for, Okay, so if you become frustrated while pursuing a goal, motivation for obtaining that goal decreases. So you lose your motivation to feel better with exercise because you think it's pointless. And other motivations begin to compete for your attention. So other motivations would be for instance, a friend of mine said, hey, I'm gonna go get some ice cream, do you want some? Well, I was doing a video and I didn't see it, and he said, well, maybe I shouldn't because it's a sweet tooth talking, and usually people go to food for comfort. I don't, because I have GERD, it just comes right back up. But a lot of people go to food for comfort, right? Well, instead of doing that, instead of other motivations competing for your attention, you need to go back and remember what you see people doing. You know, you see people walking in your neighborhood. That should give you an idea of maybe you should go for a walk, right? It's a nice sunny day. Maybe you should go for a walk. Just seeing other people is a big influence in what you do, if that makes sense. Okay. It's not about digging deep to find some hidden motivational reservoir. Okay, it's not there. It's not a motivation reservoir, okay? Doesn't exist. It is about working to have your environment support your intentions. Oh, okay. So it's working to have your environment support your intentions, as in, for instance, I try not to eat a lot of sweets, so I don't buy sweets. So they're not in my house, so I'm not tempted to eat them, okay? In this sense, it's not about digging deep to find some hidden motivational reservoir. It's about working to have your environment support your intentions. Okay, so it's COVID, right? The gyms are closed, so everybody's thrown off. But you can, I'm sure somewhere in your home, like for instance, I don't have a kitchen table. So that is my dance floor. And that's where I teach my Therex and whatever, you know. You just make some place that is yours. And that's where you spend your time, as in support your intentions. So what are your intentions? Just to get up off the couch and do something else, or move into another room, or get up and exercise, you know. You need your environment to support that. You need like a yoga ball and a yoga mat if you're going to want to do yoga, okay? This is what an exercise program is meant to help you do. So home exercise programs is usually created by a physical therapist or physical therapist assistant like me, and we give it to you, and you're supposed to do these exercises every day. But of course, nobody continues to do them after they feel better. But that's what they mean. You need a program. Don't be like, okay, I'm here sitting on my yoga ball, I'm done. You know, no, have something planned out. Write it down and be like, this is what we're gonna do. Have a plan. Okay, we're at 20 minutes. We got 10 more minutes and then I'll stop. Okay, manipulating environment to support exercise was basically what I was talking about. So link an activity you want to do to exercise. So the key is thinking of your exercise time as an opportunity to satisfy another desire. The key is thinking of your exercise time as an opportunity to satisfy another desire, providing you with a double mood benefit: joy from the activity during exercise and an enhanced mood afterwards. So examples of additional motivators, okay? Getting a break from your day for fresh air, That'd be a motivator. Having sun on your face, being alone to think, spending time with a friend, sightseeing in a different city. So these are all additional motivators that you can incorporate with exercise. Say, spend time with a friend. Well, why don't you and a friend go for a walk? Okay. Sightseeing in different cities. You know, you're out and about. I don't know. Maybe trails. There's different trails around here in Oregon. The feeling of sun on your face is, I don't know what to tell you. For depressed people, having the sun on your face is like breathtaking. It eases your soul. At least for me, it does. Okay. And the fresh air. I have to be outside of the building. Why does this do that? There. No! That's why. What is going on here? There. Okay. Sorry about that. Okay. Where dang, where'd that go? Okay. Getting a break from your day for fresh air. Also motivations. Okay, self-control, the effort muscle. Your self-control is your effort muscle. Self-control effort. Internal push you must apply to get yourself to do something. Okay? Helping to think of its effort as relying on a muscle. Your effort muscle. Okay? So you have to think of this internal push. You have to push yourself to do something, right? Think of that as a muscle. You need to strengthen that muscle to be more disciplined, to motivate you to do something. It's called the effort muscle, okay? This muscle that you use not only for exercise motivations, but also for the situations or activities that take effort, okay? So other situations and activities that take up your time, you have to put forth your effort. You also are using the effort muscle. You are putting forth yourself. You are trying to make yourself better in some type of way. Just like other muscles, the effort muscle fatigues with use, okay? So you only can push yourself so much. You can't be like, Lisa told me you need to do this, this, this. No, you need time for yourself, but you need to work your effort muscle, okay? Every day, at least once. If you work it early in the day, your effort muscle may be less available to you later in the day. So think about your daily routine, okay? If you are, I don't know, early bird and get everything done, and then you kind of slack off in the evening, then make sure you know that, your body, the effort muscle obviously is being used in the morning and then not so much in the afternoon. For me, I would sleep in the morning and I'd be up in the afternoon, which my effort muscle would be activated when I was up. Okay. Divide and conquer the value of many efforts, okay? There is always value in a tiny step, okay? Take a small step towards changing your environment. Take a small step in changing your environment. Give you a more neutral pull towards exercise, okay? Neutral pull as in sorry, I see somebody outside. Give you a more neutral pull. Focus only on So focus only on the next step that will make it more likely that you will exercise. So here's a scenario. You want to go for a run after you get off work. Okay, that's your goal. You want to go for a run when you get off work. First step, moving from the couch. Stand up, go to the other room, change your clothes. Step 2, go outside. You have been inside at work all day. Wouldn't it be nice to be outside? Okay? Once outside, this is falling again. Once outside, there is no need to break into a run, okay? This is irritating me. Ugh. Well, guys, that's being irritating. So that's part 1 of the part 2 of the presentation, and I will get back with you with the rest of it.